So it's now time for us to share with you our featured patient and her team of caregivers. For Candi Spraggins and her family, life was good. Candi was working towards her dream career in law enforcement and just about to finish school through ECPI University. 2013 was off to a great start. But on January 19th, the world changed for Candi and her family. Candi and her family began a marathon that none of them ever expected to be confronted with. A marathon of facing death, the will to survive, and the drive to recover.
I like being able to make other people smile. I like accomplishing things and learning different things and doing different things.
It was a typical day. Got up that morning, she was heading off to the sheriff's department for an internship. A little bit before 12, she left early. 30 minutes or so.
Motor vehicle accident.
There's a car pull up in the driveway.
With injuries.
Sheriff's department pulls up.
Subject was ejected.
I felt something was wrong, but it was like I wasn't putting too much into it.
She is unconscious.
It was just like maybe she didn't show up for work yet, or she's stuck somewhere.
A gold minivan into the ditch.
Initial dispatch, overturn, ejection, and they came back later and told us unconscious, barely breathing.
Life evac 1, 8-minute ETA on liftoff.
He just said she was in a bad car accident.
Looks like she was thrown from her vehicle approximately about 75 feet or so.
He said it didn't look real good.
We went to work.
We needed to head down to MCV as soon as possible.
The subject is out and breathing on the ground, however, is not responding to them.
A lot of life-threatening injuries.
The helicopter will be able to land right here at the scene.
As we were providing patient care, we did hear the helicopter circling the land.
Everything was done right there in the field where she landed.
Life evac on the ground.
There was obvious injuries throughout her entire body. It looked like a very grim sight.
We couldn't get a blood pressure on her, so we were pushing a lot of IV fluids on her to try to stabilize her.
We were having a really hard time getting those breaths in that she needed, so we ended up having to put a needle in her chest.
Life evac in there.
We were having trouble feeling pulses. We were unable to get a blood pressure all the way through the entire transport until right at arrival at the hospital.
When MedFlight arrived with Candi, we could tell that she was very sick. She had a lot of injuries.
She had an obvious pelvic injury and a lower extremity deformity, suggesting that she may have significant internal bleeding and significant intra-abdominal injuries.
We knew that she needed a lot of blood very quickly. We ended up having to put in a central line in her groin. And this allowed us to use our rapid transfuser. We gave her several units of blood, several liters of fluid. Her blood pressure was continuing to drop despite all of the fluid and blood we gave her. We decided we need to go to the operating room emergently.
In the operating room, our primary goal was to control the bleeding, and she had a significant amount of blood in her abdomen. We also noted that she had injuries to her intestines. The first thing we did was pack off her belly with pads to help control the bleeding and help stop the bleeding. But some of the bleeding was so deep that we couldn't get to it surgically. So we arranged for her to go to interventional radiology, where the radiologist can go up to the groin into the vessels and actually stop the bleeding from within.
We had an anesthesia machine, and we had the anesthesia providers helping us keep her alive during the interventional radiology portion.
So what we do is we try and control the things that may actually cause her demise first.
The expert skills of Ryan Crutchfield, Ben Lang, and Dennis Hale from Dinwiddie Fire and EMS, recognizing that Candi is critically injured and needs to be at a level 1 trauma center, is the one reason why Candi Spraggins is with us today. They immediately initiate the call to the VCU Life Evac team, and our level 1 trauma center and system springs into action. As Candi is being flown to VCU Medical Center, our trauma team is assembling in the emergency department. Emergency department physician, Dr. Michelle Trendle, prepares to take care of Candi's airway and the breathing tube that has been inserted since Candi is not breathing on her own. Regina Sen, trauma nurse, and Eve Dunning, trauma tech, prepared the rapid transfuser to give her blood, get supplies and equipment that would be used to save Candi's life. Dr. Andrew Young alerts the operating room to be ready for a critically injured patient. After a quick assessment in the emergency department, Candi is rushed to the operating room. In the operating room, perfusionist Harry McCarthy and anesthesiologist Dr. Arkady Dubovoy, along with the OR team of Ariel Button and Katie Nunamaker, a blood bank specialist, Michelle Andolina, transfuse more than 90 units of blood into Candi's body, while Dr. Goldberg and Dr. Young pack Candi's abdomen with quick clot pads in an attempt to control the bleeding and identify her injuries.
I felt like I needed to be here and I didn't want to give up.
We have a real big family of friends, and we had the waiting room full of just our people.
The hard part for Candi was only starting when she got out of the operating room, because it was at this point that all of her other body systems started to shut down. Her blood wasn't clotting, her kidneys stopped working, and we still had to give her a lot more blood.
A little over 2 times her blood volume was replaced just in the initial 7 hours. And it continued throughout the night and into the next day.
She was about as sick as a person could get. She was on full ventilator settings, in fact, very aggressive ventilator settings. She was on pressors to maintain her blood pressure.
I signed up to be her primary then. I actually didn't think she was going to make it.
Her injury to her left hemipelvis and left leg were extraordinary. What could be considered an internal amputation. So severe was the trauma to her leg.
You almost don't even remember all of the injuries. There were so many because you're just trying to keep her alive.
I remember talking to her husband, Reggie, and I remember having to tell him that she may not make it through this and that the next 24 to 48 hours would be very critical.
She has a strong will, so when they told me that she wasn't going to, that it was up to her to pull through it, I said, if anybody could do it, she could.
I remember we took her family back into the waiting room and had the conversation about, we didn't think this was going to be a good outcome. And, we talked about being a DNR, and I could tell the family just didn't think that was going to happen.
We were kind of expecting the worst and hoping for the best. We would talk about how surprised we were that even in the first couple of days that she made it through the night before.
The first, 2 weeks, it was touch and go.
Initially, we had to put her on continuous dialysis, which is basically a machine which has been cleaning her blood 24 hours a day because she was in shock and she was too unstable to tolerate intermittent dialysis.
She returned from one of her mini surgeries, and she had developed this hematoma that eventually ended up into a massive wound on her leg through her groin area, and she was so sick, and at that point we were supporting every system you can think of.
She had a bad infection she had from the injuries and stuff. Her heart stopped a bunch of times due to it.
So it was the infection, it was a low blood pressure, it was all the dying tissue and all the toxins from that she coded. I remember one time, 3 times overnight. She was brought back sometimes with chest compressions and other times with drugs.
Atropine is a medication we use to speed up your heart if it's too slow. So we just planted it around the room, and I saw her start to go down, and I just gave her the atropine, so I was able to keep that from happening after that.
Dr. Dobson in our department ended up helping some of the plastic surgeons with some of the debridements, where we debrided some of the bone that had died around her iliac crest.
We were consulted for a wound that needed closure. When we walked into the room that day and they pulled the blankets back, we actually saw what was probably the largest hip wound I've ever seen. You could actually see her pelvic bone in the wound.
We called it the shark bite after it started becoming debrided because it took out a whole chunk of her side. I mean, we didn't think even she was going to be able to keep that leg.
We explained it to them that it might come a time when it was absolutely necessary that that leg would need to come off. In other words, that leg would be the thing holding her back and making her sick.
However, the family was very adamant that we save the leg, so we had to come up with a different way to reconstruct this wound.
Ultimately, we decided that her wounds were of a nature that a vac would actually help heal her quicker than any other process.
It involved multiple debridements of the wound, very aggressive wound care and wound vacuum therapy to be able to regranulate tissue so that we could skin graft over that area.
Candi's team of caregivers in the intensive care unit are struggling to keep her alive. They spend hours at her bedside, titrating the numerous drugs and fluids to maintain her blood pressure, electrolytes, and cardiac rhythm. Trauma surgeon Dr. Rahul Anand takes Candi back to the operating room several times, attempting to repair some of her bowel injuries. Each day brings a different challenge. The skin, muscle, and bone of her left hip begins to die, and plastic surgeon Dr. Michael Feldman and orthopedic surgeons Dr. Bucker and Dr. Greg Thompson take Candi to the operating room to debride the dead tissue. Candi develops a fungal infection, and her condition begins to deteriorate further. Clinical pharmacist Greg Chenault struggles to find antibiotics and medication to help kill the fungus and other bacteria that have now invaded her bloodstream and bones. While she's in the ICU, over the course of several days, Candi's heart stops, not once, not twice, but a total of 5 different times. And each time Candi's heart stops, the team is able to bring her back from the brink of death. But the treatment options are dwindling as the infection persists and her organs are failing. Dr. Whalen and the ICU team call on cardiologist Dr. Richard Shepard, who inserts a pacemaker to regulate her heart rate. Candi's heart rhythm begins to stabilize, but her lungs and kidneys are not functioning effectively. Throughout this tenuous time, Chaplain Lemuel Solano and child life specialist Heather Kinney supported Candi's family and 7-year-old daughter Maria and helps the team deal with the tremendous array of emotions we encounter with a patient who is so critically ill.
I was more concerned how Reggie and Maria were. I didn't really focus on my injuries at all at first.
The team going into the room every day and updating the family and very honest about what they thought was happening and what the prognosis would be. And of course, day to day that changes, and so it's a difficult realm to surf through.
Everything they was doing, they let me know. They did everything they could for me while I was there.
I called them so many times at night, during the day. We kept pretty good contact with them.
Her family was awesome. She had a husband and a daughter. The daughter came in a couple of times. Smartest little girl. I mean, she was 6 years old, but she was really cool about everything that was happening. You know, she'd draw pictures and send them in.
They were very hopeful all along that we were going to be able to save the leg, and they kept asking us to be able to do that, and we kept our promise with them and were able to do that.
We were all impressed with the forward motion that always kept going with her care.
And, you know, it was a couple weeks later, she kind of turned the corner.
I was there when she first opened her eyes up, and she looked at me, and she looked around because she was trying to figure out where she was at. Because at the time, she couldn't talk because she had a breathing tube in. So she looked at me, and she calmed down. I think probably glad because I was there to calm her down.
It was very hard for her as she woke up and learned what was going on. This was going to be a long process for her. I remember a time standing there where she had these tears in her eyes, and she too didn't think she was going to make it. And I kept saying to her, Candi, you've come this far. Keep fighting. You can do this.
She was always a trooper, especially the more awake she got and the more interactive she got. She always took all that pain with a smile and was willing to have us help her out.
She just started making urine, and we knew that that's the first sign. And once that happened, very quickly, she was off dialysis.
And I remember her asking me very clearly, am I still a DNR? And I was like, oh my gosh. I've never had a patient actually ask me that before. And I was like, oh, well, you know what? You don't need to be anymore.
Yep, that was a good day for her. Everybody was real emotional because she was in there for a while.
And this is all new bone that's starting to form. She likely won't be able to put full weight on that leg in the future. She's able to start using that leg for more balance, which, again, given the complexity of this injury, is a miracle.
Once Candi was not requiring a lot of medical support and all of her major medical issues had stabilized, and this took about 4 months, she was able to go to the rehabilitation doctors where she could get the care to start building her strength again.
Definitely she had a lot of weight-bearing precautions and just a lot of limitations, and on top of that a lot of fear of moving and pain. It can be a scary thing for a patient, I think, as they start to explore what's safe for them to do for themselves. And I think in order to be able to do that, you need to have a lot of trust in the people that are working with you.
She went from a place of being unsure to really feeling confident in what she needed and what she wanted.
When she finally came through, she set a goal for herself then. She wanted to be out the hospital before my daughter's birthday.
Finally, Candi's body starts to respond. Her blood pressure and cardiac status stabilize, and the fungal infection that have invaded her bloodstream begins to clear. Dietitian Linda Creasy determines the nutritional requirement that are required to heal her massive injuries and wounds. After 95 days in the trauma intensive care unit, Candi is stable enough to be transferred to our trauma acute care step-down unit. Here, the nursing team of Caitlin Reynolds, Katie Black, and Deanna Stokes provide the daily care that Candi requires. Candi is so weak, she can barely move her arms or legs by herself. She's not even able to sit up or turn over without the help of 2 nurses. Occupational therapist Bridget Lossell and physical therapist Carmel Colin begin working with Candi to strengthen her arms and leg muscles. Trauma surgeon Dr. Paula Ferrada, nurse practitioner Renee Seaman, and pharmacist Travis Gatesman work with the wound care specialist to manage the lingering infection in her massive leg and hip wound. Candi's rehab team, led by Dr. James McGowan, creates a plan for Candi that ensures her continued recovery. The therapist and nursing staff in rehab challenge her each day to work harder. The journey to recovery is not easy, but Candi has the will and the drive to live life to the fullest, and nothing is going to stop her. Rehab psychologist Cynthia Rolston works with Candi and her family to deal with the many emotional challenges that accompany such complex injuries. Finally, in late June, Dr. McGowan and his team say, Candi, you are ready to go home.
I needed to just keep going. You know, I figured that I had a different purpose. I mean, God wouldn't have waken me up if He didn't want me to live.
There were so many times when we talked to the family and said, I think we need to reevaluate the situation. And to go from that to seeing somebody in a wheelchair going home is why we do what we do.
She was in my hospital more than a month, and she set up a birthday party. And get everything straight, like she ain't miss a beat.
One of the things she had going for her was just good family support. You know, she was not on her own, and she isn't on her own out there, and that makes a big difference.
She knew that they were there and that they were supporting her, and she, I think she drew strength from that quite a bit.
She gave me a Christmas card this past year, which had this beautiful picture of her, her daughter, her husband, and looking at her there, you couldn't have known what she had been through the last year.
It really does touch you at how happy she is and how happy she is to have come through all this and and come through this with such a positive attitude and just happy to have every day, and it really shows in her, and it's really contagious.
I'm just so happy she was able to go home, be with her family, be with her daughter. That things, could have been so much different, but now things are going to be great.
And to have somebody come back and talk to you and be a productive person, go back to their families and take care of her little girl is what this place is all about.
Yeah, big time second chance. Yeah, big time second chance. Yeah, second chance we ain't gonna waste.
So Candi spent more than 5 months at VCU Medical Center and underwent more than 20 surgeries. While Candi's care and her journey to recovery continue through this day, we are proud to share that Candi has been able to return to school through the support and encouragement of ECPI University. Candi will finish her degree in criminal justice later this year and looks forward to working with the Dinwiddie County law enforcement agencies. Candi's family stood by her side and cried with us, prayed with us, and challenged this outstanding team of nurses, radiologists, surgeons, therapists, technicians, pharmacists, and hundreds of others who could not be mentioned or recognized tonight to ensure Candi would be with us today from the moment of the car crash through Candi's ongoing treatment. This is why we do what we do. This is the village of providers that makes VCU the only level 1 trauma center in Central Virginia and the best level 1 trauma center in Central Virginia and the Commonwealth.
I just wanted to take a minute. I'm a mess, I'm sorry. I just wanted to say thank you to everybody that helped me from the beginning, the rescue squad, all the way through my aftercare after I left the hospital. And this is the best hospital and medical center that I could have ever gone to because they were so good. And everybody was not just doing their job, they actually got to know me and they treated me like a person and not a case number or a name. They took the time to really get to know me and they were very supportive of my family. So I just wanted to say thank you so much, and there's no amount of words that I could say that could show how much I appreciate everything that they've done for me. So thank you very much.